This video is on cardiac arrest in adults and CPR. The first section deals with chest compressions and how to locate the ideal spot for chest compressions. Put your hand underneath the armpit and slide right across, generally along the lines of the nipple towards the middle of the chest, putting the heel of the palm in the middle of the sternum. Place your other hand on top, interlock your fingers, pull your fingers up, and that's how you landmark for chest compressions. The other way you can do it is to follow the rib cage to the xiphoid process with two fingers, and then put your other hand superior to those two fingers, placing the heel of your palm in the middle of the chest. From a body position standpoint, you want to make sure that your arms are perpendicular to the body, and as you compress the chest, to lean into your arms, making all the movement come from your hips. For chest compressions, rate and depth. The depth is 2 inches, or 1/2 to 1/3 the thickness of the chest. The rate of compressions is 100 per minute, roughly 30 compressions in 18 seconds. When performing chest compressions, you want to make sure you get adequate depth, but you also want to make sure that you allow the chest to recoil back to its starting position. This allows the heart to refill with blood again in preparation for the next compression that you administer. This first scenario will demonstrate a supine athlete wearing no equipment in cardiac arrest. First of all, stabilize C-spine when you get to the patient. Assess responsiveness, and if they don't respond, call EMS. Head tilt, chin lift, look, listen, and feel. The victim is not breathing. 2 rescue breaths. Breaths go in, maintaining an airway with an oral pharyngeal airway. Checking circulation for no longer than 10 seconds. No pulse. Start CPR right away. 30 compressions, 100 compressions per minute, 30 compressions in 18 seconds at 2 inches deep, or 1/2 to 1/3 the thickness of the chest. Alternate 30 compressions with 2 rescue breaths. Continue the sequence until an AED arrives. You are too tired to continue. If the scene becomes unsafe, or if the victim starts to show signs of life. When the AED arrives, stop CPR and apply the AED right away. So make sure that the chest is prepped, there's no water and no excessive hair. If so, apply the pads to the upper right and lower left, and then plug in the connector, and then just simply follow the prompts.
Apply pads, plug in connector. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Paused. If needed, begin CPR.
So in managing a situation where the victim is prone but not wearing equipment, grab C-spine, assess responsiveness, no response. Hey, you go call EMS, I have an unconscious adult, please come back. Checking the airway, look, listen, and feel for breathing for 10 seconds. Victim is not breathing. Roll the patient right away. Head tilt, chin lift, look, listen, and feel for breathing. Not breathing. Attempt to ventilate. Breaths go in, but there's no pulse. So I started CPR. In the middle of CPR, once the AED arrives, stop CPR and apply the AED.
Stay clear of patient. Deliver shock now. Press the orange button now. Shock.
In this next clip, we'll take a look at how do you access the chest and lift the face mask in a prone athlete. Grabbing C-spine, assess responsiveness, no response. Hey, you go call EMS and get an AED. Open the airway, take out the mouth guard, look, listen, and feel for breathing. They're not breathing, so we have to roll right away. Once rolled, check circulation first. No circulation, access the chest and start chest compressions. "30 chest compressions as soon as you can. After 30 compressions, initiate face mask removal if you have the ability to. If this takes longer than 30 seconds, helmet and shoulder pads have to be removed in its entirety. In this particular case, we can access the airway and just provide rescue breaths with the helmet and shoulder pads still on. After the 2 breaths, just continue with CPR until the AED arrives. Once the AED arrives, it's important to stop CPR immediately and apply the AED. Again, just be aware of metal and water around you. It is okay to apply the AED with the football equipment still on. Now, if you don't have face mask detachment tools, you may have to do full equipment removal right away. In this particular case, we rolled the victim and checked pulse. Since there is no pulse, the priority is to start chest compressions right away. So we're accessing the chest. Starting our compressions, and once the compressions are done, initiate full equipment removal at the time in which you would normally provide the rescue breaths. The process of removing the rest of this equipment should again no longer take more than 30 seconds. Once the equipment is off, depending on how long it's been, go right to compressions. Once the AED has arrived, just as per usual, apply the AED right away. Again, listening to the prompts, check circulation and breathing to see if you need to continue to do CPR. This situation deals with someone you actually see collapsing. Stabilize C-spine and assess responsiveness. No response. Activate your EAP. Look, listen, and feel for breathing, and if they're not breathing, immediately roll the victim. Once they're rolled, open the airway, check the mouth, look, listen, and feel for breathing. The victim is not breathing. If the victim is not breathing, start compressions. Typically, when an adult just suddenly collapses, the cause is typically cardiac related. As a result, if the person is not breathing, start CPR. Continue with this protocol until the AED arrives. Once it arrives, apply it as per usual.
Deliver shock now. Press the orange button now. Shock delivered. Paused. If needed, begin CPR.
Again, in following the prompts, check circulation and breathing to determine what type of management procedures you need to continue to do. So here are the key points. Airway, breathing, and circulation is how you would typically manage a cardiac arrest victim, or any victim. However, if the victim is wearing football equipment, it's important to check circulation first, and then airway, and then breathing. If the person does not have circulation and they're wearing football equipment, it's important to access the chest immediately and start chest compressions right away. When you're doing chest compressions, just remember to do CPR at a ratio of 30 compressions to 2 breaths, 100 compressions per minute, which is equivalent to 30 compressions in 18 seconds. The depth at which you want to compress is about 2 inches, or 1/3 to half the thickness of the victim's chest. The key thing to remember is to push hard and push fast. Once you've started CPR and the AED arrives, just follow the protocol or the prompts that the AED gives you. One of the key things in managing cardiac arrest is being able to recognize when the person is in cardiac arrest and starting compressions as soon as possible.